The CDC is considering a big change in isolation guidelines for people with COVID, similar to guidance for the flu and other respiratory diseases.
It would remove the 5-day isolation advice for those who test positive. Instead, people would be able to leave their homes if they've been fever-free without the aid of medication for 24 hours. Right now, we are joined by Dr. Thomas Russo, an infectious disease expert at UB. Thank you so much for joining us this afternoon.
My pleasure.
Okay, so first, as a little bit of a refresher, tell us what the current guidelines are from the CDC when it pertains to COVID-19.
The current guidelines are the 5 and 5 rule. 5 days of isolation, followed by 5 days of wearing a high-quality, well-fitting mask if you venture outside your home. You could also test out if your test is negative at day 5 and 7, and that will also get you out of isolation, and you don't have to use a mask if you test negative twice.
Dr. Russo, early on, especially during the pandemic, people were following these rules to a T. You're in this profession, you're a medical expert. Do you think that people are still largely following these guidelines, be it the 5-day isolation or 10-day isolation or wearing that mask, even if you're symptomatic? I know they're supposed to, but do you think people are?
Unfortunately, no. We did very well early on in the pandemic, but we've regressed to the mean where people are going back to work when they're not feeling well, often not even testing. I think part of the consideration of the CDC making this change is if they make it easier for people to get out of the house, then maybe they'll be better at testing and using that mask when they eventually leave the house. A caveat with the change of guidelines that they're considering is that once you get out of isolation, even if it's a sooner period of time, that you should still wear that mask, or at least that's being talked about right now.
Do you think this potential decision would make a difference as far as workplace policies go?
I think it's going to be helpful in that, unfortunately, some people didn't have sick leave. And so, therefore, it put a huge burden on them to be isolated. This will enable them to get back to work sooner. But again, I think the key caveat here is if the CDC recommends mask usage even when you get out of isolation. And I certainly think that's a safe thing to do. Just to be clear, even though you may no longer have fever and your symptoms have resolved or getting better, you still could be infectious. And so backing this up with mask use is going to be particularly important, especially if you interact with those vulnerable individuals. COVID remains a very severe disease for that high-risk group.
Dr. Russo, we've had you and some of your colleagues on over the past month and a half as the flu and respiratory virus season really took off here in Western New York. Are you starting to see that wane now that we're a little further from some of the holidays like Thanksgiving or Christmas or New Year's? Are we starting to see those numbers come down, or are we still experiencing kind of a peak here?
Fortunately, we're on the downward curve. So RSV is way down. We've turned the corner on flu as well. There's still a fair amount of COVID out there, though, since we no longer report cases, it's a little more difficult to track. However, I think we're in the back end of the winter respiratory virus season, but we're not done yet. And so it's still important for people to be cautious out there, particularly if you fall in that high-risk category.
We do have to wait and see if the CDC officially makes this decision pertaining to these guidelines. But do you think it could potentially lead into more cases if people aren't, staying home those 5 days?
Well, that's one of the concerns, and I think a couple of things is worth noting here. First, the CDC makes recommendations, but ultimately it's going to be up to the state to make a decision whether they want to enact those particular policy changes or not. Secondly, 2 states have already embraced a policy, California and Oregon, that's similar to what's being proposed by the CDC. The good news is we do have some data from Oregon, which began this policy a while back. And at least at this point, it doesn't look like transmission rates are up. However, I think it's too soon to be absolutely sure about that, but I think that's encouraging news.
Yeah, we'll end with that encouraging news there. Dr. Thomas Russo, thank you so much for joining us. We appreciate your expertise.
Thanks for having me.